Hi everyone, hope you're doing okay. This is Impromptu Live to discuss about menstrual cups and how they are basically worn and what to do about it. I'm waiting for more people to join. Hi. So, yes. So, first of all, thank you for joining, whoever who was available on Saturday evening. I wanted to talk about how to wear a menstrual cup. This question has been coming again and again, and so I wanted to address it today. And so I thought, let's come live, then sharing a separate video about it. So first thing first, whatever menstrual cup that you are using, just make sure that you are cleaned your hands properly and with soap. That is important. Your cup should not have any stains or anything, like stain in the sense stain of blood or anything. So you have removed whatever that was remaining on the cup if you have used it previously. So then only you should boil it. You should not boil the cup. The blood soaked, so the one which had blood on it, please remove it completely with cold water first, and then maybe you can boil it either at the end of your menstrual cycle or just before your cycle starts. Anything that works fine for you. Very important point is whatever cup you choose or whatever you are using. So there are few important things that you need to remember. Is first is the cleanliness of the cup. Plain simple cold wash is that is you can do. If you are traveling, you can carry a small water bottle with you. In that you can keep a clean water with you if you are not sure if the public toilets will have water. Now, how to wear a cup? So, firstly, it's very important if you're using the cup for the very first time, like, or you're not even sexually active, you never had a sexual, activity, then it's very important to know that you have three openings down there. Okay, one is the one where you urinate. Second is your vaginal canal through where you bleed, and also like if you opt to have a child, your child will be born from there. And third is the anal hole. So three different openings you have. Okay, so where is vagina? And then there is lot of buff about checking your cervix length and all. It's totally okay, whatever you decide. If you want to, you can insert your index finger and check how much index finger goes inside. So the whole finger is going inside. So like for example in this model, so which means that person has a high cervix. But only this much is going, which means it's a lower cervix. This much is going, then just this much. Then this is the medium. This is the standard size. This is something that 90% of menstruators, this size will suit, like the standard size. A lot of cups have that will be suiting many people. And so there are two approaches: either this checking your cervix and choosing which cup suits you best and then deciding which size suits you best, or there is other approach, buying a standard size cup which could suit 90% of people. Like for me, I never checked my cervix. I just brought a standard size cup, and I'm still using the same cup. I did not feel any change in 7 years. So like my body went through a lot of weight fluctuations and everything, but still I'm using the same cup. I know a lot of people who delivered their babies and they are still using the same cup. So there is very less difference that happens in your body when it comes to size of your menstrual cup and the cervix length. For some people, they may prefer harder cups post delivery. That is okay, but that's a very personal choice, and I will not generalize it for everyone. Okay, so for people who have never had sexual activity in their life, they may not know that there are three separate openings down there, and in the second opening, that's your vaginal canal. It's not like straight as you see. A lot of people think that your finger should go straight, the cup should go straight. It's not like that. I'm just busting this myth here because it's not like that. Your body is like that. The canal is like this. So basically, if you see it, it's like this. So if you're trying to insert cup straight, it will not go inside. If you put it this way, like a slide, basically, the slide that we used to play as a child, it's like tedha, tilted. So aim towards spine when you are trying to insert your finger or you are trying to insert the cup. So if you put it in a tilted manner, then only the cup will go inside. Otherwise you'll feel it is blocked somewhere. I'm not able to insert cup. Like I'll just fold the cup. So you have folded the cup. Now you are trying to wear cup. This is your vaginal canal and this is how you are. This is in actual. But what you are doing is, lot of people, they are trying to insert it this way instead of putting it this way. We are trying to put it this way. So this is the mistake that lot of people do, and as a result of that, lot of people feel unsuccessful. They feel I'm not able to wear cup, I can never be able to wear cup, but that's not true. And sometimes it's also a mental block that works for that is something that inhibits some people from trying cups. Sometimes it's trauma, it's sometimes some unpleasant memories that stop us from wearing cups. I hear you, and it's completely okay if you choose not to wear cups, but I would suggest, if you want to consider using reusable options, I would suggest there are options like period panties. So for example, this is a period panty that is leak proof and it also absorbs a lot of blood. Then there are options like cloth pads, which you don't need to insert and you can just wear them. So there's absolutely no pressure to try just cups. There are so many basket of options that is available. Not bucket, I'm sorry. So so many options are available, and you can choose from whatever that suits you and what you that you feel comfortable. Because something, if you do overnight, you just shifting to something. Sometimes it works for some people. For some people it may not work, the sudden shift. For some people, they find it really difficult. It gives them anxiety, and that is completely normal. But don't do such sudden shifts, I would personally say. So if you are a new user who is trying out a new product, maybe a cloth pad or a cup or a period panty, whatever it is. So generally, lot of times how it works is, I have seen is, people either buy a huge set of cloth pads so that they always have a good stash, so that they don't have to depend on other products. So that is something. Some people use a combination of disposable and reusable options in the beginning. I have also done that. Like on my heavy days, I used to use a cloth pad, and on my other days, if I'm not very sure of it, I used to use a combination of disposable pad and a reusable pad. But that was for a really short while, because I did not like disposable pads at all. I used to get horrible rashes with it. So for me, it lasted for very less time. With cups, I use a combination of cloth pad and cup sometimes, because at times I'm not able to insert my cup. It's because I have really bad cramps or something. Then I use cloth pads. So it's something that you can decide for yourself. And okay, there's a question, ma'am, if there's any problem in cervix or pelvic floor muscles, they should not use cup, right? So yes, if those are really weak, you may feel that the walls are, the cup is pressing those walls. So that feeling may come to you. So they may not use cup. It's a personal choice. I will and if you have such issues that your pelvic floor muscles are, they are not very strong, I think you should also take a medical advice to just see if everything is okay, if it's it's just a normal thing. And if your pelvic floor muscles are, if you feel that they are not so tight, what you can also do is Kegel exercises are really nice thing. I've been doing them for a really long time, and that is one thing. Other thing is being physically active. I know a lot of women and menstruator we do a lot of work, like we do cooking and so several other things, but that is not exactly which helps our body to get strength. For that, you need to take out dedicated 10 minutes or 20 minutes, whatever that is possible for you, just for yourself, and make yourself physically healthy and fit. Because that the effect will not only be physical, it will also be mental and psychological. So yeah, any other questions if we have? and you can keep asking the questions. And it's very important, if you're a menstrual cup user, it's very important to know that your hygiene is very important, and it's you who decides when to wear a cup, when not to wear a cup, or whatever product that you choose. It's completely your choice. Own that choice. And when you're making this conscious choice, give yourself some time, because a lot of people, they are in hurry. They are like, this product should work for me. That should is limiting, I think. That's not helpful, because if you put yourself in such boxes, it will not help you in, because it will give you anxiety that why this is not working for me. I so want to try cloth pads, but then I am not sure if I'll be able to wash them, if I will not be able to change them in time. Take it slow. Break it down. And so initially what you can do is, if you go outside for work, then maybe come back home and then try cloth pads or cup, whatever that you want to try new. So that is something some people try. Feel comfortable in that. Once you feel confident, you can wear the same product for, those 4 days, 5 days, whatever you choose to, whatever days you bleed. So take it slow, break it down, and don't push yourself to say, no, this should work for me. Because if you push yourself a lot, it will give you anxiety, and instead of you enjoying that new product, you feeling how it exactly feels, you may feel anxiety and not the freedom that you would like to, get through that product. Can first time menstruators like girls of ages 12 to 13 use menstrual cups? I know a couple of them who have used menstrual cups. They are using since they were, 10-year-old, not 10, I would say, 12 or 13 is something. I have heard from 11-year-old also. But that is not something that I would, very strongly recommend, because it's a personal choice. And another thing is, these girls especially, they are, growing bodies, and they're just learning about what menstruation is, what their body is. So I will not really force these girls to, try menstrual cups. They can try with cloth pads, they can try the period panties. Because in the beginning the periods are also not so regular, so after 1 or 2 years the periods may regularize. So maybe, like, once they are, comfortable with the idea of getting periods, maybe they can try a cup. I know some people who used the cup from the first day of, from the menarche. I know some people, but for this they had a really supportive community, like community in the form of good friends who have used cup, or community in the form of having their mother and aunts who have used cups, and they helping them navigate of how to use and how to, take care of yourself while using cups. So having that community, irrespective of your age, it's very important, who supports you through that, when you make this change of using reusable products. Okay, there is a very nice question. I have a copper tea and I am interested to use cup. My gynecologist said that use cup without trimming the thread. I feel bit afraid to use. Okay. Ma'am, I would suggest, if your gynecologist has given a green signal, it's a good thing, I think. Just check with her if you can trim it a bit, like, if you think that is giving you anxiety, that if it's making you fearful, because sometimes there is a possibility that you may accidentally pull those threads and may dislodge your copper tea. So that is the fear, or that is a possibility, I would say. But just check with the gynecologist if if there's something to fix that. So yeah. So and even after you're using, like, you have copper tea and you decide to use a cup, you just have to be mindful that you break the suction properly and then only remove the cup, so that you don't, and also like not touching the strings of your copper tea. So, like, and that is, again, this is a learning curve, so you will figure out your way, don't worry. For first time, many people are telling measurement for cups should not do during periods. But I think should do periods only, because during periods there is a chance to cervix. Yes, so if you are going to do this measurement of, how much is your cervix length, so that you can decide which size of cup to use. Yes, it's very important you check your cervix on the day when your period is heavy. So like for some people it's the first day, for some people it's the second day. So you see what is your heavy day and you check it on that day if you want to go by that approach. Because then only you will know the cervix height changes across the cycle. It's different in all those, if you have a 30-day cycle or a 40-day cycle, whatever, across that the cervix height changes to some extent. It's not a major shift, but there is some change. Okay, someone is asking, can you show me again how to insert? It's been 2 months since I used, but the first couple of inserts feels a bit tough and also spotty. Yes, in the beginning there's a high chance you feel a bit discomfort while wearing the cup, and you may feel that it's sometimes pressing your vaginal walls or something. You may feel you may not be able to pee or something. That will happen at the very first time or first few attempts, I would say. That is a thing that will happen. But once the cup is gone inside completely, it has opened fully, the feeling of discomfort slowly goes away. And sometimes it's not just discomfort also, sometimes it's also this constant conscious feeling that there's something inside, what if something happens to it? So that that curiosity or that mental chatter happens sometimes. So I think that is also something that happens. I will show the folds again. Yes, I'm just checking if there are many more questions. Thank you, Hia. You're really sweet. So I'm just showing how to insert cup again. There are 3 different types. There are many types of fold actually. So I know 2 or 3 which I can show. So one is this kind of fold, which people call either C or U, whatever you call it. So this is one kind of fold. For many people this works best. And this kind of fold, once you have, I'm just showing it how to insert it again since people had asked. So it's like tedha, the canal is tedha. So you're wearing it like this and the cup is opening, it's forming a suction. The stem should also go inside if possible. If not possible, you can probably trim the stem if the stem is longer. If it's not longer, so this has a really tiny stem, so this should not be trimmed. It could be filed probably, but not trimming. Okay. Because then if you remove the stem of this one, then it may cause damage to the cup, so we have to be careful about it. So this is one kind of fold that I have shown. Another fold is punch down. So this kind of fold, see if you can see that. So for me this works really best because it makes this this circumference is reduced and it makes the entry easier for me. So this is another fold. And then there is 3-4 types of folds. Then there are this 7, and then there is rose and many other folds. So this is another. Okay, I cannot even. Sorry, I would suggest you Google. So there is a 7 fold, there is a rose fold, there are other folds. For different people, different folds work. So you can just Google and check. And yeah, so this is important things about menstrual cup. Hia says 7-fold works for me. Yes, I think it's 7 if I'm not wrong. Maybe Hia can confirm. This is the 7 I'm guessing. So yeah, but I have never used it, so I will not say this is the perfect I have done. So yeah, so these are different things about menstrual cups. And there's one more thing that I keep getting asked again and again is, will it lead to loss of virginity or something? I need to tell you, virginity is a social construct. That is one thing. And another thing is about virginity, the hymen, which is overhyped that we all have. The hymen is not inside this. It's not something that that will stop you from putting your finger inside or a cup or a tampon. No, it's just an extra tissue just at the opening of your vaginal canal, which can be stretched. And while stretching, some people may experience mild bleeding, ekdam mild. and it is not like for some people it's like, oh, I lost my virginity. It's not like that. Your body has not gone nowhere, and it does not change anything about you. You choosing to not have a sexual activity, or you choosing to have sexual activity, changes nothing about you. You're still the same person. So yeah, please don't be bothered so much about, and the hymen is something that is just an extra tissue, and it may get stretched by any activity. Like if you are physically really active, your hymen may have stretched long ago, so you may not experience bleed when you have sexual activity, penetrative sex especially, for the first time. So it's not it's not necessary. So yeah, so I think we all need to learn that lot of things are learnt, and we are not born with all this conditioning that we have, that this is not good and that is not good. So yeah, make conscious choices about your own body. You decide what is good for you, and there are a lot of people, including me, who are happy to help you about, be about your bodies or menstrual cups or cloth pads. So yeah, have a nice day. Bye bye.